Healthcare costs are continuing to rise, and so benefits leaders need to get creative in managing spending while also meeting a wider range of employee needs. What are they doing and how are they doing it? Here to talk more about that is our panel. I'm just going to go down the line and have everyone say their name, their title, and their organization. Let's start with you, Scott.
Scott Kirschner, Senior Director of Global Benefits at Greystar.
Amy Claffey Widell, Global Benefits Director at Akamai Technologies.
Shaina Islam, Vice President of Human Resources at Zensar.
Cody Fair, Chief Commercial Officer at Noom.
And Bijal Toprani, Doctor of Physical Therapy and Clinical Solutions Lead at Hinge Health.
Excellent, great. Well, Cody, I'm going to start with you. As employee needs are changing, what types of benefits are you seeing the most meaningful to workers right now?
Yeah, I think that typically what you see is it kind of comes in waves. I think during the pandemic, there was a big push around mental health and a lot of benefits put out during that time. And what we're seeing right now, certainly biased from my perspective being at Noom, but with the advent of GLP-1s and medically assisted weight loss, one of the hottest topics we're seeing in the industry is around weight management. So we're seeing a lot of different organizations. For the first time, that's kind of moving to the top of the list, something that maybe fell kind of below the line for years and years, but because employees and members are wanting access to GLP-1 type medications, it is putting that at the forefront. I think outside of that, we're seeing a lot of talk around women's health, specifically around menopause. And then something that we see, especially at Noom on the consumer side of our business, is the population's changing a little bit, where it used to be individuals wanted to live longer. Now it's they want to live healthy longer, and they're concerned about their health span and longevity and how many healthy years they have left. So I think it'll be interesting in the coming years to see if that starts to bleed into the kind of the employer realm.
Shahina, what are you noticing in terms of wellness support?
Yeah, as an IT organization, I think, we are seeing a lot of what Cody just mentioned. What we are also seeing is that, the focus on mental health continues, despite the pandemic having, gone about 4 years ago. So, and that we think is only going to increase because there's a lot of uncertainty in the environment in general. So I think that's going to be a key focus areas, but also as an organization, we focus on overall happiness of our employees. That's something that we practice very intentionally as part of our cultural framework. And because of that, we have programs which not only focus on physical health, focus on mental wellness, but holistic well-being, which includes even things like financial literacy, how do we plan for retirement. So we put a lot of efforts on such programs as part of our benefits program. As far as diversity and equity and inclusion practices are concerned, we have gone into spaces like, providing support for fertility, building a program which addresses some of those requirements for our women employees and, also for parents in general, bringing them resources so that they are more adept at, being those parents, whether at any point in their time when they go into those life transitions. So it's basically a holistic mix of, aspects that can provide a holistic well-being for our employees.
For a very diverse workforce,
yes,
too.
Yes.
So Amy, at Akamai, you compete with Cisco and Amazon, these giants, for both product and talent acquisition. How do you manage that challenge while staying within budget?
Yeah, it's been really hard. Our employees have a lot of expectations and compare us to those companies all the time, and we just don't have the market share to keep up with them. So what we've been doing is just slowly tackling benefits that can give us the biggest bang for our buck, both with impacting our employees, but then also potentially helping with our savings. So over the last few years, we have been looking at our high-cost claims and what our top spend are, and then saying, okay, what can we do to hit musculoskeletal, fertility, cardiovascular, cancer? And so we've been implementing point solutions where possible, and where I'd love to have done all 5 in 1 year. I'm slowly doing them year after year and really creating that business case to our senior leaders of, if we implement a mental health benefit, we're going to see a decrease in claims from our medical spend. And we implemented a point solution 3 years ago, and we've seen a 10% decrease in the claims in our medical plan. They've shifted to that provider, but they're lower cost through them, and we've gotten some great results from that.
Bijal, employees are increasingly looking for a more seamless experience. How are you using digital solutions to meet those needs?
Yeah, so as I mentioned, my background is in physical therapy. I'm a PT. And so before I joined the digital space, I worked in brick and mortar environments, right? So if anyone in this room has gone to in-person PT, you can already count all the barriers. But my patients would have to take time off work, drive to the visit. Sometimes you're being seen at the same time. Even as a provider, I didn't love doing that, but that is kind of the nature of how it is in physical therapy world in the traditional sense. And the other one thing that I noticed a lot is there isn't a lot of good adherence. I was just talking to someone today that was saying like, oh, I went to physical therapy, but once they gave me my exercise paper, like I was not gonna do that, So the outcomes aren't as good. And so with digital care, I'm noticing that we're really able to take an ordeal that could take 3 hours and turning it into a 30-minute access thing. So I think access and benefits is always a big thing. How do you make it easier for people to actually get the care that they need? And so I think the digital space is just allowing people to engage with a lot of different type of healthcare in a more seamless way through an app experience, maybe outside of traditional provider hours or whatever that may be. And then there's also the transparency from the provider side. So with the world that I'm in now, I can actually see, oh, my patient's not doing their exercises. Let me, send them a message and say, hey, can you get back in and do those? And so it's just improving the seamlessness of actually engaging, but the seamlessness in staying adherent, which obviously then has impacts on outcome too.
And with that seamlessness comes this need for communication and effective communication. And particularly when you have a dispersed workforce, this is a really big challenge. Scott, can you talk a little bit about what you've noticed with your dispersed workforce and remote workers?
Yeah, so, Greystar, most of you probably don't know us, we're the largest developer, builder, manager of essentially apartments in the US. We have about 3,500 properties. About 25,000 US employees, very dispersed, and then on top of that, we have about 40 offices and a large remote workforce. In fact, like I work from home, my team is all work from home, all dispersed. So our biggest challenges, and I've been there a year and a half, has been just even basic awareness of what we have. By any measure, our utilization has been below book of business. And we have big opportunities to change how we communicate and raise awareness and raise utilization. And I liked the introduction around the idea of multimodal. Long talked about that, and we need to think about communicating a lot, use every avenue we can, and get people aware. And like, one example I use is how do we interact just in our daily lives with technology? I think all of us have searched for something on Google, and the next thing you know, everything you open has an ad for that particular item, and it's just following you. I'm like, stop it. But we have virtually everybody's cell phone number in Workday, and we don't leverage it today. And yet you go to our properties and everybody in the property is texting each other. Mm. And my business pitch to leadership is we should be doing the same thing. Mm. That's one example. So why aren't we operating more in a modern way with texting, and if you want out, you opt out? Mm-hmm.
Great advice. Shayna, what have you noticed about keeping everyone connected and meeting employees where they are? Because yes, you have those people who are constantly online, but we also have 5 generations in the workplace. Mm-hmm. Some people are maybe less online.
Yeah. So we operate out of 30 global locations, but a large part of our workforce is based with the customer. So we have embraced remote/hybrid in a big way. But what we also were very clear on is that connectedness is not something that we are going to lose out in the new normal. So while we have all the conventional means inclusive of, using our managers and our leadership teams to amplify some of the key messages through the interactions, through the forums that they conduct, maybe, even to do a project meeting, but we would build in, a very key message for the employees into some of those forums as well. But we also have leveraged technology in a big way. So recently we implemented one of the platforms which is AI enabled and which is more to do with continuous listening. So what that does is, it doesn't matter where the person is based. The technology is at work when some of us are sleeping and collecting all those voices from our employees and bringing it to us, which through a regular forum, we may have never heard them. So that's an example, but we also use our employee resource groups because that's a community of Zensarians, managed by the Zensarians, as we call ourselves. And they have been very helpful in, helping us understand, okay, the generational workforce that we have, multi-generational workforce that we have, what are their needs, what are their aspirations, what are they looking for, how we can support them. So these are some of the conventional and the technology-enabled mechanisms that we have deployed, which are proving very effective for us.
Listening to employees
Yes,
and having them tell you what they need. Scott, I want to go back to you and your point about meeting employees where they are, which is often on their phones. How are you using those kinds of technologies and digital shorts, videos to help employees understand the complexity and navigate that complexity of their benefits?
I mean, it's a great additional point because I think about all of it in terms of, we increasingly become a video population. People read less, but we're still going to use email and so forth, even in terms of filtering down like 1-2 minute videos on one topic. Just understand this, this service to what we call property managers. So the person running an individual property or a couple of properties that are next door to each other. Just share this with your population. We've even had success. Just put this QR code in the office, have people filter up, you may be interested in this, they may not. But I think, I've challenged a number of our vendors. Give me like short form videos that we can use, whether it's testimonials or basic description of what it is. Like Hinge has a couple of good brief videos around this is what it is and this is what the person's doing and how it helps them, just so they understand. But I do think even like once you get success, I did this in a prior position. I was one of Livongo's first customers when they were tiny, and we did videos of the people with diabetes who were benefited by the program, and it just had more power knowing it was an actual employee giving that conversation versus, hey, I'm the head of HR. No offense to the head of HR, but and ours is Scottish, so a lot of the Americans can't understand her.
Accents.
Yeah, but I think those things can be very powerful.
Exactly. Okay, so Cody, weight management is becoming more of a focal point for a lot of companies and benefits. How should employers approach providing treatments and access to GLP-1 treatments, especially as demand is rising?
Yeah, so I would put, I guess I would make kind of 3 points on that. The first thing I would say, and every conference I've went to for the last 2 years, GLP-1s comes up and everything is about cost. And that is understandable. But I would tell you to think about the member experience if you do plan to cover these medications. I won't bore you with the entire story, but I have a personal journey with GLP-1 medications to where I got access. It's changing my life. This chronic disease I've dealt with my entire life, or my adult life essentially, and then I lose access. I can't find them anywhere. From there, then I sit in prior authorization after I get access for months and months and months. Then we change carriers in January, and I sit in prior authorization again for months and months and months. It's terrible for someone like me that I finally found this medication that's going to change my life, and I've spent 1.5 years chasing it down. So I would say, cost, I understand, it is a big deal, but think about the member experience first. If you put these massive, prior authorization things that need to go in and 6 months of this and that, I would say to look at that and think about your team members if you do choose to cover it. From there, if you do choose to cover it, I would make sure you go in eyes wide open. and really model out what that cost is going to be. There's a lot of employers right now that have covered the medications and are going to, and understandably so, the cost was far more than they planned, and they're going to have to pull back coverage. Again, that's a really, really bad experience for a member that is taking this medication, is changing their life, and for them to go buy it on their own. They could do like a Lilly Direct for $500, but it could be upwards of $1,300, and most people cannot afford that on a monthly basis. So I would take that into account. If you're going to cover it, make sure that you're going to cover it long term. The third thing I would say then is I would look at alternative methods. If you're going to do it through the PBM, and that is certainly a model that you can choose, but make sure you realize there are alternative approaches out there. You can carve AOMs outside of the PBM. There's ways to cover it through supplemental benefits at a much, much cheaper cost. You can even do things to where you can, provide them access through Lilly Direct and things like that. That's $500 compared to typically you see through a PBM after rebates, you're paying $750 to $850, could be higher than that. So I would look at alternative funding methods as opposed to just sticking in the standard kind of PBM model, because there are ways that you can access these medications at a much reduced cost.
If an employer is going to offer them, decide to provide them in whatever form, what other kinds of benefits do you recommend, or do you recommend other benefits for that employee health and well-being?
Yeah, so sadly, I'm also a case in point for this, that just because you're taking a GLP-1 doesn't necessarily mean you're making healthier decisions. It just frankly means you're eating less in most cases. So I would highly encourage to support with wraparound services. Obviously, I work for Noom, which is one of them, but there are many great vendors out there to make sure you're helping them with the lifestyle and behavior support to go alongside these medications. Most people do not want to take them for the rest of their life. And if they're not changing their behaviors along the way, once they go off of them, the weight gain is going to come back. So there's a lot of great vendors out there that help you with the behavior change. They help you with the exercise, the nutrition. There's communities where you can be around like-minded individuals. Obviously health coaching and all of that, but I would make sure to provide those services alongside the medications if you're going to do that. One of the things that we always say is your PCP or a physician that would be prescribing, they only know what happens inside those four walls. And once you leave, you're gone. And that's where the employees really need support, especially if you're going to pay for these obviously very costly medications. Make sure you offer the behavior change support alongside that to help them with long-term success.
So Amy, you've worked with multiple vendors around mental health and fertility. What are the factors that you use to determine the ROI on these vendors? And what do you think about when you're trying to decide whether to stay with a vendor or switch?
Sure. So as I mentioned before, we've been tackling our high cost claims and seeing where can we make an impact. And so, the first area we've looked at obviously is, has it impacted our claims, which isn't necessarily going to be at the end of year one, we're going to see a difference. Where, especially on the fertility side, it could just have a tough year and lots of babies being born. So we're, but first is really looking at those claims and making sure that, we're seeing that change. Obviously, employee feedback is something that is really important for us to hear. If we're making a journey harder by carving something out, we don't want to continue to do that. So really taking that into account. And then also, new people come on the market every year and everything. That's part of the problem. And people are being constantly acquired. It seems like we work with a vendor, 2 minutes later, they're being acquired by someone else. And so now we're working with this vendor. And so it's really looking at, every couple of years, revisiting the market, seeing who's out there, seeing if we can consolidate vendors. I mean, we talked about point solution fatigue, and I think there is a product potentially coming in the near future where we can give a bucket of money and people can go out and choose their point solutions that work for them. But until that happens, I don't necessarily want to have 500 vendors. So, looking out to see who we can consolidate to make sure that, maybe it's fertility and mental health are the same benefit.
Because this is a mentally and emotionally exhausting period for these employees' lives if they're suffering from mental health issues or fertility issues. So what advice would you have to overcome that point solution fatigue?
I think part of it is what we're all talking about is the communications and making sure that we're doing the best to provide our employees with the best resources to use those programs. So we're not just dumping out, okay, here's your new fertility benefit, have fun. We're doing webinars, we're providing great resources on our intranet site. In some cases, for most of us, my team, we try to use the benefits. So we did implement Hinge. All of us on the team signed up. My budget is not happy about that, but all of us signed up to use the program so that when people come to us with feedback or questions, we have our firsthand knowledge of knowing, that's a one-off experience, the rest of us were fine, or no, that is a consistent issue.
So Shahina, what are you doing to measure success beyond just participation in terms of employee well-being? I know you said you look at employee happiness.
Yeah. I think, that's something that we take as, the all of everything that we are doing is we need to ensure that we have a very happy and engaged workforce, and therefore our annual survey has a big section on how employees are feeling valued, and benefits is a big component of that. What we also do is, we do our regular reviews with our service providers to look at utilization, look at the claims history, look at, what are the kind of ailments that are, the chronic ailments, how is that, shifting over a period of time. So data analytics, we've kind of brought that into our benefits program management so that, we are not blindsided by anything. The third component that we look at is absenteeism. So if there are issues that are cropping up and, people are being absent, even mental health issues or stress management issues, that could also be a lead into, okay, what more do we need to do on benefits front to counter what we are seeing on absenteeism front. And fourth, I would say, is exit interviews, which is pretty reactive because it's like, it's at the fag end of everything, but it still gives us an opportunity to address, depending on what the analysis tells us. So yeah, so kind of, being, again, very comprehensive in our way of looking at, okay, what's working and what's not working, and what do we need to focus on, and how do we bring that into the execution model.
And what do you wish employees knew about the benefits available to them?
Yeah, my wish, and I know my benefits team would concur with this, is that I wish the employees, one, would leverage all that we have as services. I find that there are pockets and there are some great components in our program which go underutilized, and which could have been, maybe then we don't know whether they are seeking those kind of services from outside. So that would be a wish, and I discussed that a lot with my team, that how do we make our employees know everything that our program has to offer, because it does come at a great amount of investment on the employer's part. And the second is, I wish, there's a lot of time that our employees would spend while deciding which program works for them. I don't think we have reached a stage where we can say it's 100% personalized, but there's a lot of effort that has gone into personalizing it in a way that there's little bit of something for everyone. So knowing that and spending that time, it does help in cost management eventually, but it does bring about overall benefits for our employees. So I would wish that they would spend a little more time in considering what options they're going to be choosing.
So Bijal, you work on both the strategy side and the clinical side. Can you talk a little bit about some of the creative ways that you're engaging with members?
Yeah, sure. So we've talked a lot about the multimodal approach. I think that that's really important with, I've had patients that are truck drivers that I've done like a video visit, physical therapy visit while they're sitting in their truck. They're parked somewhere, but the point is that they received marketing that was put on their windshield on each of the driver's cars, and so they saw the collateral there and thought, oh, okay, I should do this. And so some of the employees don't really check their email, they don't use email, and so we still really rely on home mailers a lot of the times. Sometimes with our pelvic health program, even if it's a really male-dominated world, we'll still send the home mailer because their spouses are at home maybe and seeing that. And so it kind of depends on the population. Something in manufacturing that has worked really well is we'll put up posters that'll say 3 exercises if you're on your feet all day, and then there'll be a QR code on the bottom. And so they're almost associating their pain maybe or their exercise with this particular benefit. And then some of my favorites, and China, you mentioned this, is really working with some of the ERGs. And so we, like I said about the pelvic floor program, we added that in 2023. And so sometimes when people think of like MSK, muscle joint pain, they might not think pelvic health related stuff. So we've really worked with the women's health ERGs, the parent ERGs, where we'll come and do a webinar for that population. They're already kind of dialed in and more interested, and then we can kind of target that particular group, and then it kind of spreads from there, or maybe it's hosted by that ERG and then the rest of the employees come. So those are some of the creative ways that we've kind of approached capturing, engaging people and finding them where they are.
And you've had some success of getting point solutions to work together too, right? Because I mean, we've talked about point solution overload and fatigue. How do you make sure they are playing nicely together and aligning for the employee experience?
Yeah, so this is something that I've heard more and more as I work with patients, but then also with employers, is that, you know, how will someone know if they have other vendors that they have access to? There is kind of like that appetite for that. So we've actually started taking the benefits guide once someone implements and placing all of like the vendors that particular client has within what I use to do my patient care. So it'll be like all the ecosystem partners. Oh, there's a mental health benefit. There's a diabetes benefit. There's a X benefit. And so when I'm communicating with the member, if they're sharing something with me that's like totally out of my scope, oh, I'm really feeling depressed, or this is what's going on, I can easily see that and say, well, did you know that you have Lyra or Headspace or Calm or whatever it may be, and kind of help with that. So that's what we're doing internally. But sometimes we also will speak with the vendor directly. So like Progeny, for example, we trained their care team advocates on our postpartum pelvic health program, so that when someone goes to them, they know what we do and we know what they do. So just it takes a lot of work, but we're trying to make it more seamless.
Amy, after launching a benefits and wellness survey, you identified some gaps in caregiver and menopause support. How are you addressing those gaps now, especially with your global team at Akamai?
Yeah, sure. So, I mean, we were lucky after we did our survey and we found out that menopause was one of the most requested benefits to learn about. We were already implementing a fertility benefit that offered menopause support. And to no surprise, that's our second most requested journey in that. So we were really lucky that the timing worked out from that. When it comes to the caregiver, I'm still looking, to be perfectly honest. That is one of the tougher areas for us globally to find. You know, we have great benefit here for backup care in the US. It's just not the same elsewhere. So it's really starting to look at local vendors. Unfortunately, you know, we would love to have a global vendor, but you know what local vendors are out there. But what was really interesting for us during that survey was learning how many people just didn't know about the benefits that we already offer. So people would be like, hey, can you offer us this? Well, actually, here you go. It's right here. We've had it for 5 years. And so one of the things we're working on right now, and I wish I could trademark this or tell you that I came up with this, but our Moments That Matter pamphlets and brochures. And so really looking at a way for us to do exactly what Bijal you're talking about in combining those benefits that are going to matter to that person at that time. So I'm having a baby, okay, or I'm thinking about having a baby. Here's our fertility benefit. Here's our backup care benefit. Here's our pelvic support benefit for after you've had that baby. Because someone's not going to pay attention until it matters to them. And I hate to stereotype men, but especially I feel like some of the men in our workforce, like, nope, all of those family-friendly ones might go over their head until their wife is saying, I really need this benefit out there. So we're trying to work on that. So we're doing it for, you know, menopause support, babies, all the different areas that we think can help people. So that way it's easy for them to find all those point solutions. And like you said, those hidden benefits that people might not realize are part of something that they already offer.
Well, Scott, in thinking about those moments that matter, there's the I'm thinking about having a baby, or I'm approaching menopause, and then there's I just got a diagnosis. So how do you connect the benefit to the employee in real time and make sure that they have easier, quicker access to the benefits they need in those moments?
So, I kind of go back. One of the things that I've been fascinated about, but still the promise is more than the actual delivery, has been digital navigation, just very data-driven digital navigation, and worked with an early organization that's been acquired, and based on a lot of promise that didn't come out. But one thing that I've been fascinated about, and we may be getting closer, is we all know, like, there are promises, if you're self-insured, from your health plan administrator, if you're not so much from fully insured, but case management, or getting to somebody who potentially has a physical injury that virtual PT may be part of the musculoskeletal treatment. It's getting them early in their treatment. And if you know anything about the electronic medical records industry, there are two dominant vendors in it, and then a lot of distant third, fourth. And someday somebody's going to have real-time connectivity with Epic and Cerner and be able to, you see a doctor, you get a new diagnosis, there's a new ICD-10 code generated that wasn't attributed to you. And within 24 hours, you're notified about a service that you have. Whether it's, oh, I hurt my knee. I had this exact experience. Luckily, I know how to navigate the system. But like for us at Greystar, cancer, oncology is our #1 major diagnostic category by a good amount. And we are implementing a cancer solution, but it's like this, how are we going to get people to use it if they don't know about it? And you hear a cancer diagnosis, outside of like something like a skin cancer, you're panicking, you start Googling, you start talking to other people, you don't know where to go, and that's where a lot of the waste occurs. If within 24 hours you could get a text message or a notification or something, or an outreach call that says, hey, Greystar covers this service for you 100%, and if you latch into it, your deductible's waived, your out-of-pocket maximum is waived. Let's have a conversation about your treatment options, second opinion, home infusion therapy, something like that, rather than waiting for that claim to be generated and for it to go to another vendor. So someday, anybody with a lot of money who wants to invest in that company, it's not me, I am not doing like early stage company. But if you could come up with that solution, I think there would be a big market. And it's not going to be the health plans doing it. And it's probably not going to be the providers doing it. Somebody's going to do it.
Cody, I want to return to the topic of metabolic health, and you shared your personal journey as well as the Noom perspective. But what is your advice for companies who want to take a more proactive approach rather than reactive approach?
Yeah, like where we started, I think weight management has kind of moved towards the top of the list of things that are important for employers right now, and that is because of GLP-1s. But I would encourage you to get in front of the GLP-1. 74% of America is overweight. Many of those individuals can be helped before they would be considered clinically obese and eligible for GLP-1. So I would encourage you to get in front of that, put programs in place. There's a lot of different things out there. You can do behavior change programs, fitness, nutrition, a lot of other ways, but to try to get in front of that. Obesity is related to 10 plus other chronic diseases, and oftentimes it's tough because it's the absence of future claims is where the ROI is. So it's not this hard dollar savings that you see from a diabetes claim that came through and is no longer there, but you're really just getting in front of it. And we're seeing, which I think is good because GLP-1s are such a craze right now, that employers are starting to do that. They're starting to put programs in place to help their employees out before they really need those medications. And one of the things that we track is the cost of 5% weight loss. It's kind of a metric, frankly, that we started tracking and made up. For a GLP-1, the cost of 5% weight loss is exponentially higher than if you put in a fitness program or a behavior change program and something like that, and how it can help for future healthcare costs is pretty substantial.
Okay, I'm interested in all of your thoughts on this. What is one new benefit you think will be essential in the next 5 years? Let's just go down the line. Scott?
I do think it's going to be new platforms around communication and how do you get in front of people, but very much communications that are personalized and are driven by your actual data.
Okay. Amy?
I do see, I think, I hope I'm not stealing it from you, but I do think the GLP-1s and finding those holistic solutions to help, because we're learning it's not gonna they're gonna impact our costs immediately, but they're not gonna necessarily lower our costs in the long term because people are gonna stay on them. So that goal of having, we'll have less claims in this, it's not gonna happen. So we need to figure out a way to help people eventually get off those medications and stay in that healthy range that they've gotten to.
Shayna?
I would say, not a benefit. I would say it wouldn't be something new. It would be more of focus on mental health and wellness. But I also think that there'll be a lot of use of AI in this space, so that the timeliness of action, is there on all parties involved in this process. So I would think there'll be a lot more of that. There's not much of that happening today. So I think that's a space that's going to be really exploding.
Okay, Cody?
I would say that I think we're very early stages in benefits and solutions around menopause, and I think that will continue. Although I think that's in the conversation now, I would expect over the next 3 to 5 years that that's a much, much bigger portion of the conversation than it is today.
Bijal?
Yeah, I'd agree with the menopause case. I think it's starting to be discussed more, but I think there's a lot that can be done in that world, and so there's going to be an expansion of that. And then also Shayna's point regarding, using AI within some of these point solutions to make it more personalized. I think the adoption of people feeling comfortable with virtual care took time. And now that we're there, there's a higher expectation that it is really personal and it is really timely and it is human-centric. And so how are we going to use, technology and AI to, hit all of those criteria that I mentioned?
Menopause is having a moment. Okay, so, yes, go ahead, Scott.
One of the things because we've got 2 minutes, is to the audience, one thing I would also say, since part of this is about balancing cost, I have seen in my career too many times people trying to assign a return on investment on a particular initiative or solution or anything. Look at the cumulative effect of everything you do. Are you managing cost and trend from everything you do? And are you reaching the maximum efficiency on those things you do? Don't just say, back to like Noom or Hinge, this is what I want the ROI to be for Noom or Hinge. It's like, are you affecting the bottom line of everything?
That was going to be my last thing, is asking everyone for a hot tip on how to bring down
That's my
costs. That's
I
your
stole
hot
your
tip,
thunder.
is look at the cumulative effect. We got a great one in our intro with holding the drug rebate accountable. But any other insights on how to drive down costs? Your best tip, Amy?
I would probably say don't be afraid to fail. I know it's silly, but try something. If it doesn't work, keep trying again. It's just, you're never going to know. So don't be afraid to try something new and to fail.
Shayna?
I would say focus on simplification and enhancing the awareness. I feel that's the only way to bring the cost down, because more people are aware, there would be better consumers of all that is to be offered. So,
Cody?
I would say at risk of maybe angering some of the digital health friends in here, push your vendors towards outcomes-based pricing. So stop with performance guarantees around ROI and that stuff, and put pricing models in place that are based on them delivering outcomes instead of negotiating this, fuzzy ROI with the PG that might come back years later. Focus on outcomes up front.
Okay, Bijal, last word?
Yeah, I'd say comms on getting people sooner in their journey. So, before they're having a surgery or X, Y, and Z procedure, but working on some sort of comms that capture them when it's just an ache or just a belly ache and not a gargantuous issue.
Excellent. Well, thank you all very much for a great conversation.
Thank you.
Thank you.